we encourage you to subscribe to MedSearch Moments wherever you listen to podcasts.
Do you have plans September 12th through 14th?
The AMSN Annual Convention is the can't-miss event for medical surgical nurses.
Register now to join AMSN in Toronto, September 12th through 14th, 2024.
And prepare to connect with hundreds of peers for 3 days of learning, the latest insights, trends, and best practices in the specialty.
Visit amsn.org to secure your spot.
This is Eric.
Mary Tess.
Sydney. Sam.
Neo.
And Laura. Welcome to MedSearch Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud MedSurg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Nowadays, it seems the whole world is going virtual. In episode 111, we explored the emerging world of virtual nursing. Now, the nursing profession and the Medical Surgical Nursing Certification Board is embracing this change with the CAVRN, pronounced CAVRN, the Certified Acute Care Virtual Registered Nurse Certification.
In this episode, we'll delve into the significance of this certification, its benefits for both nurses and employers, and the requirements for eligibility.
With us today for our CAVRN orientation is Emily Schmidt. Emily has been a dedicated nurse for 14 years with extensive care in emergency medicine, virtual nursing, and as a virtual nurse educator. She played a key role in helping develop the Certified Acute Care Virtual Registered Nurse Examination, showcasing her commitment to advancing the profession and educating others in the field of virtual nursing. Emily, welcome to MedSearch Moments.
Thanks so much for that warm welcome. I am really thrilled to be here on MedSurg Moments and really excited to talk about the field of virtual nursing.
We are so happy to have you. But before we dive into the conversation, I think our listeners would love to hear a little bit more about your personal story and what inspired you to pursue nursing.
I am originally from Indiana, but I currently live in beautiful Honolulu, Hawaii, so aloha everyone. To be honest, I had no intentions of becoming a nurse initially. Fresh out of high school, I was pretty uncertain about my career path. I went to college, changed my major numerous times, bouncing from public relations to occupational therapy, elementary education. Through all of those different career path changes, I never really found something that I was set on that I just really loved. I felt like I was kind of wandering aimlessly at that time. I knew that I was really interested in medicine, and my mother, my role model, she suggested, well, why don't you look into the field of nursing? She said, you have a great personality, you like to help people, you really like medicine, you can combine all of those things into the career of being a nurse. And so that's kind of what I did. I took her advice, and I thank her every day for that advice. I worked ER the vast majority of my nursing career. I wanted to try something different. I had kind of got just a little bit burned out with the emergency department, so I wanted to try my hand being a labor and delivery nurse. So I transitioned to that and realized very quickly that it was not my favorite area of nursing. I was pretty well desperate to get out of labor and delivery, so I started my journey of looking for some remote positions. I had heard a lot about remote triage and remote virtual nurses at inpatient. And so I started my search looking for a virtual career. I had applied for hundreds and hundreds, easily, applications, trying to find something that combined all of my skill traits but was virtual. I ended up meeting somebody on LinkedIn and really just kind of lucked into my position being a virtual nurse in an inpatient setting. And so fortunate, that's where I still am today. And I absolutely love it. I wasn't really happy with the labor and delivery, but it got me to where I am today. And I'm so thankful for that.
That's a great story. If you have challenges and you turn those challenges into positive moments, I think that's a perfect example.
Absolutely. I would agree with you. It's made me who I am today and got me where I am today.
Well, as mentioned last fall, we did an episode on virtual nursing at the AMSN convention. But Emily, please remind our listeners, what is virtual nursing?
Before I dive into that, I really do want to say that episode, I've listened to it myself, very insightful, and really encourage all of our listeners to go check that out. Virtual nursing is really a transformative and innovative approach to delivering care through a digital and remote technology. Instead of being physically present with patients, virtual nurses use video calls, remote monitoring systems, and electronic communication tools to provide care and support to both patients and bedside staff. A little fun fact that I like to share with everybody: Space Labs Healthcare, which is a product of NASA's Gemini product, developed real-time telemetric monitoring. It was designed to be able to monitor astronauts' heart rates, body temperatures, etc., while they were in space and transmit this to the ground. And this is kind of the same concept that virtual nursing uses today to remotely monitor patients.
That is so interesting. Wow.
Yes, I love to share that fact and educate people about that because it's so cool. I'd also like to note that virtual nursing within a hospital setting is really meant to complement the bedside nurse, and it is not meant to replace them. And I think that's a very common misconception that I see about what virtual nursing is. It's more of a collaborative approach, and I really hope that eventually it is fully seen in that light because it's really a cornerstone of modern healthcare delivery, and I think that it's going to continue to rise in popularity over the years.
Definitely think you're right. I'm seeing a lot more references to it.
Mm-hmm.
But what core attributes do you think are essential for a nurse to have in order to be successful in that virtual care setting?
Yeah, I'd be happy to kind of elaborate on that. I think to be successful within a virtual care setting, nurses really need to have a combination of several core attributes, especially when it comes to being able to blend that clinical expertise along with technology. Virtual nurses really need to have a good, solid foundation in clinical knowledge in order to be able to provide quality care and patient education. Virtual nurses really play a crucial role in educating patients about their conditions and their treatment plans because virtual nurses really need to be proficient in using technology, telehealth platforms, EHR systems. This involves using technology to be able to track patients' vitals, symptoms, and other indicators from a distance. So they need to be proficient in interpreting these data points and identifying trends or abnormalities that may indicate a decline in a patient's condition, because this early recognition could potentially prevent complications and improve outcomes. Another attribute would be basic troubleshooting skills. In this field, we often encounter technical challenges like Wi-Fi outages, headset malfunctions, for example. The ability to be able to troubleshoot these issues quickly is paramount. Knowing how to switch to a hotspot if you have a Wi-Fi outage, or resolving a frozen connection with a patient really demonstrates the ability to adapt and ensures uninterrupted care for these patients. Finally, I think I would say effective communication is really crucial in a virtual setting. It's really an art almost to be able to build rapport with patients and provide compassionate care through a screen and making these patients feel heard and supported. Sometimes working remotely, you have to rely solely on verbal and physical cues from patients, and you need to be able to pick up on those cues. You'll also be communicating as part of a healthcare team, giving report to bedside nurses, ensuring continuity of care, and facilitate learning if your facility utilizes virtual nurses to help educate other nurses with an e-consultation or mentorship program. So communication is really important in that aspect as well.
I have so many aha moments on those statements that you shared, especially virtually educating the other nurses, because that's my current role. I'm like, that's a good idea.
Yeah, it's a wonderful concept if it's utilized properly. The turnover rate in hospitals is so high. You have new people coming in constantly, and it's a great opportunity to have an experienced, knowledgeable virtual nurse on the other end of the screen that a new graduate could phone a friend, sort of, and reach out for assistance if they're unsure of a workflow or a policy or how to do the certain care for a patient. It's really a great opportunity to expand the services that virtual nurses can provide.
Absolutely. And what an amazing resource for some of those new grads that are newly on their own.
Yes. Yeah.
Let's move on because we want to have time to talk about the certification exam. So, Emily, can you please explain what the CAVRN exam is and why it was developed?
Certainly. So the CAVRN exam was developed to establish standardized credential for nurses who are specializing in virtual care. As healthcare increasingly incorporates telehealth and remote patient monitoring, there was really a growing need to ensure that nurses have specific skills and knowledge to provide this high quality care in a virtual environment. The CAVRN exam validates these competencies to assure both employers and patients that certified nurses are well equipped to deliver this care effectively.
If I am a nurse and trying to get into that field, I want to see my strong points. What are the specific categories or components that I'll be tested on?
That's a wonderful question and really important. So the CAVRN exam assesses a wide range of skills that are specific to virtual nursing, which include but are not limited to proficiency in telehealth technology, remote patient monitoring, and digital communication. Unlike traditional nursing certifications that focus primarily on in-person care, the CAVRN exam emphasizes the ability to provide care via these digital platforms. And it also covers legal and ethical considerations that are really unique to virtual care. Some of the components of the exam include quality and safety, just making sure that we are providing high quality care through these remote platforms, and really understanding protocols for virtual visits, identifying potential safety risks through a remote setting, and being able to implement measures to mitigate these risks. The CAVRN exam focuses on patient and family education. Being able to effectively educate patients with their health conditions and treatment plans is a core aspect of all nursing. But virtual nurses need to be able to tailor their approach to ensure comprehension and engagement without that face-to-face interaction. The exam assesses communication skills. We talked earlier about how this was so important because you have to be able to establish rapport with these patients through videos and be able to effectively convey medical information to these patients. Being able to ensure appropriate closed loop communication with all of your bedside staff is also assessed on the exam as well. The exam assesses CAVRN nurses' ability to be able to provide guidance and support to fellow nurses. This involves virtual mentorships, coaching, feedback, and then just overall support and encouragement of your other peers. The exam focuses on leadership skills, which in the virtual setting would include things like team coordination, training, decision-making, and conflict resolution. And finally, the CAVRN exam also covers informatics and technology. It assesses the test taker's ability to use technology to improve patient outcomes. This includes managing EHRs, understanding telehealth software, and definitely using and ensuring good security of patients' private health information. So you can see that the CAVRN exam really focuses on equipping nurses with the specialized skills needed for virtual care, which really sets it apart from traditional nursing certifications that emphasize in-person clinical skills.
So I do have a follow-up question. Can you share a typical day of a virtual nurse?
It's very differing depending on the organization and the tasks that each organization wants you to complete. I worked with one organization where we covered the entire hospital and we focused solely on admissions and discharges, and that was it. So when a new patient would be admitted to the hospital floor, these bedside nurses would help us get the equipment set up, and we would connect with the patient and we would go over their entire admission, which really helps offload some of that work for these bedside nurses. We could do everything from their medication reconciliation to their medical history, surgical history, vaccinations, religious preferences, anything that's going to be included in that initial intake, we could do. We could also help with care plans and charting these nurses' care plans. Most med-surg nurses especially really despise care plans. And so they were very thankful for us stepping in and helping with the charting of care plans. And we could also help scribe assessments. Now, while we were remote, we couldn't hear things like lung sounds or heart sounds, but we could do visual assessments of the patients. And most often what we would do is the bedside nurse would be there with us, with the virtual nurse initially, and would tell us their assessment. So they would listen to bowel sounds, lung sounds, and tell us. They could leave the room and go do other patient care while we finish the admission and we scribe their assessment for them, again, offloading some of those additional clerical tasks to alleviate some of that workload.
That sounds very interesting, like amazing, like really leveraging the technology that the hospitals have already.
Yeah, and lightening the load a little bit for those bedside nurses.
Exactly. That's our goal, is to not only help the bedside nurses with some of these tedious tasks, but also to help patients and kind of increase the interaction and make these patients feel heard. Sometimes in a hospital setting, the nurses are so busy, so go, that they don't have a lot of time to spend with these patients. And I think that's one thing that sets virtual nursing apart, is that most of the time we have the ability to sit there and listen to these patients and hear their stories and make them feel heard and really give them that kind of one-on-one attention that they deserve. There's also another side to virtual nursing that's not in the hospital setting, but you can also do things like remote triage and monitor hotline calls for patients calling in with symptoms and helping them assess what level of care they need. Remote patient monitoring, where you're remotely monitoring these patients' vital signs that maybe are at home, and then also hospital at home settings. That's kind of on the rise too, where these patients can get hospital level care in their own home. And most of the times there's a virtual nurse that's involved with that as well.
Have you had a bad day virtual nursing and what that looks like?
We all have those. I think some of the biggest challenges are when you're working on the hotline, there are days that calls are just nonstop. You can't even document on your last call before your next one comes in. It's really hard to assess patients sometimes remotely because they don't give you a lot of information. You're kind of investigating. They're very vague with symptoms, and you kind of have to take what they give you and be able to dig a little deeper into that to be able to guide them to the care that they need. And then within the hospital setting, challenging days would just kind of be when you're not really getting utilized, which falls back on educating the bedside staff on the services that we could provide and how we can help them. Once the bedside staff really understands the scope of a virtual nurse and what they can do to help them, I really think the uptake in its usage will increase. And that also goes to informing patients that you may interact with a virtual nurse and explaining why this virtual nurse is here to help you. They are here to assist your bedside staff in providing care. And so those are some of kind of the biggest challenges that I have seen, is just getting people to really understand what virtual nursing is and what we can do.
Let's talk about the benefits of CAVRN to both the nurse and employer. How do you see CAVRN certification impacting the future of nursing, especially in terms of career advancement and patient care quality?
The CAVRN certification holds substantial benefits for both nurses and employers because the exam opens the doors to these specialized roles within virtual nursing. It signifies advanced expertise in delivering care through these platforms and kind of makes nurses more competitive in the job market. For healthcare organizations, employers really benefit from having CAVRN certified nurses because these nurses adhere to these standardized practices and guidelines. It helps promote consistency in care, enhances patient safety, and contributes to overall improved clinical outcomes. These CAVRN nurses are proficient in utilizing these platforms, which can lead to streamlined workflows and improved care coordination, which can ultimately reduce healthcare costs, minimize patient care gaps, and supports the organizational sustainability.
Have you seen any impact on reducing hospital readmissions?
Absolutely. That's one of the great things about virtual nurses being able to spend that dedicated time with patients at the time of discharge, because we can sit there with these patients and really go over their discharge education and their medications and make sure that they fully understand their diagnosis, which can help reduce readmissions.
Follow-up appointments, explaining all of this.
Exactly.
That's amazing.
Yeah, remote patient monitoring programs have really helped too with reducing readmissions. In a recent study, there was a hospital that I had looked into that implemented these RPMs for chronic patients, and they saw a 50% drop in 30-day readmissions.
Wow.
Yeah, resulting in over $500,000 in cost savings that were associated with readmissions.
That's incredible. Wow. I'm so excited to watch how this field grows. Thanks so much for sharing all of that with us.
Of course.
Just one more question. What are the eligibility requirements for someone to take the CAVRN exam?
To be eligible for the CAVRN exam, there are two primary criteria that you need to meet at the time of your application. First is which is your licensure. You need to hold an unencumbered and current license as a registered nurse in the United States, its territories, or Canada. And secondly, you need to have accumulated 1,000 hours of practice within the last 2 years in a virtual acute setting, which can be a role as a clinical nurse, manager, or an educator. And while it's not a strict requirement, it is really recommended that you have at least 2 full years of practice in a med-surg setting as an RN to kind of help you prepare for the exam. And all these criteria are set in place to ensure that candidates have the necessary experience and background to excel in the field of virtual nursing and uphold those standards of the CAVRN exam.
Emily, it's been both inspiring and refreshing having you with us on this episode of MedSurg Moments.
Thank you so much. It's really been a pleasure to be here on MedSurg Moments. I've really enjoyed being able to share my experience and insight on virtual nursing, and I hope that our discussion has been both informative and inspiring for our listeners. It's a really exciting time in nursing, and I am very, very passionate about virtual nursing and being here and having the opportunity to contribute to the conversation. So thank you again for having me.
I will say you have inspired our hosts as well.
I agree, 150%.
Good. I'm happy.
To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of MedSurg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to MedSurg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurg Moments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love MedSurg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the MedSurg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Laura,
Mary Tess,
Neil,
Sam?
And Sydney. And always remember, MedSurg Moments is a moment in our lives and a moment in our MedSurg careers that makes a huge difference.